Welcome to Module 1. Epidemiology is the study of the distribution of health needs, including disease, impairments, disability, injuries, and other health problems in human populations. The ultimate goal of epidemiology is to identify the causal factors that could be eliminated or modified to prevent or control adverse health outcomes, and apply the knowledge of these to improve the health of populations. We hear a lot about population health in organizations. While the operational definition of this is often vague, you can think about this course as having a managerial focus on population health. To do this, we'll use this conceptual model for how we apply epidemiology to the healthcare delivery system to improve the health of a population. Let's briefly walk through each section. First is population. Attributes of a population that are correlated with health include age, gender, race, ethnicity, education, employment, and income, with age being the strongest and most consistent predictor of health needs in a population. In the text, you'll see a population pyramid. We'll use this throughout the course as you predict the needs of your community and the ability of your health system to meet those needs. We'll use the Cornell PAD projections to do this, where we'll use a population pyramid to project for New York State county population increases. Let me show you that now. Here we go to population pyramids. We can select our county, as well as the year, with projections currently out to 2040. Check this out for your county. All you do is put in Cornell PAD projections into a Google search, and you can follow the same steps that I have. Adjust the year to see how the population will change. How do you think these population changes will impact your facility or health system? We need to be looking at this proactively to determine the needs in upcoming years, and that's exactly what we'll do on the final course project. We can also look at trends in population globally. We know that the vast majority of population growth is in developing countries. So look at the text for the projections for global population. How will this impact you? Are you considering opportunities beyond our borders to address more global healthcare challenges? There's going to be an explosion of these opportunities in years to come. And please feel free to reach out to me if you'd like to discuss that in more detail. So now we're going to move on to need. This is a real or perceived deviation from a societal norm of health. As we consider need, we typically think about it from a population perspective. Need at the community level can be measured in a number of ways, including vital records, surveys, absentee rates, non-prescription medication, and potentially avoidable hospitalizations. What we are trying to do is anticipate the use of health services before they actually happen. Utilization of healthcare services is the point where someone recognizes a need for help and formally receives care. There are three ways in which formal health services are categorized, and those are primary, secondary, and tertiary prevention. Primary prevention includes measures taken to provide people with knowledge of disease prevention before the onset of disease itself. Secondary prevention is a form of early disease identification and treatment. While tertiary prevention are activities and interventions aimed at reducing morbidity, mortality, and disease progression in those that have an existing health problem. The Institute of Health identifies 6 domains for quality healthcare delivery. Healthcare service delivery should always be safe, effective, patient-centered, timely, efficient, and equitable. When we look at healthcare services, there are several factors that influence utilization. Those can include demographics, household income, type of provider, type of organization, whether it's a university or a community hospital, payment source, cost of care, and knowledge and beliefs regarding the efficacy of health services, among a number of others. But again, the biggest factor affecting utilization is age. Our ultimate goal in the EPI framework is population health. The most widely used definition of health is the World Health Organization's definition that states that health is the state of complete physical, mental, and social well-being. There are countless global health indicators to measure the health of a population. Here, I'm showing the World Health Organization's 100 core health indicators. These are constantly updated and something that you should familiarize yourself with. Regardless of the measure of health used, better population health should be the overall goal of any healthcare provider, organization, or system. So now I'd like to ask you, what are your organization's goals? See if you can find out. The ease in which you can do this is directly tied to the healthcare leadership and organizational culture within your institution. If these goals aren't clear, what can you do to change that?